So by now, I think we are all pretty well aware of the opioid epidemic and what it's been doing to our country recently. According to the CDC, in 2016, the number of opioid-related deaths is about 5 times what it was in 1999 and continues to grow. And on average, about 115 Americans die every day of opioid-related deaths. So in response to this, we've had to kind of evaluate ourselves as healthcare providers and see what we've done to, number one, land us here, and number two, what we can do to help create a solution. Uh, Anesthesia providers are no different. Might not be the number one thing that you think of when you think of how we can make an impact on this crisis, but we've certainly been looking at ways to decrease the amount of opioids that we expose patients to, and strategies in decreasing the way that we can, or in the amount of opioids that we send these patients home on. So one way we've been doing this is the ERS protocols, or the Enhanced Recovery After Surgery. And it's a multimodal approach to anesthesia, including blocks, preoperative evaluations to identify patients that might be more at risk, and then interoperative strategies like goal-directed therapy with fluids, and multi or polypharmacy approaches like using ketamine in your normal routine. And these are great because you can kind of cater it to your patient population, the surgical procedure that you're using, and then even influence like your provider, your surgeon can also provide some feedback on what they've seen postoperatively, how the patients respond. So it can kind of be catered to each patient and each patient population, which is great. So what's great about this is that after the surgery's over, we might see a decrease in their hospital stay, their financial commitment. Obviously, if they're not in the hospital for as many days as they usually would be, it's a decrease in their financial burden, as well as the hospital's resources. And more importantly, decreases their amount of postoperative complications, as well as their postoperative narcotic and opioid use. So these patients are going home healthier and faster and needing less narcotics, so less supply is going out into the world. So we can certainly not prescribe, we're not really influential in prescribing the narcotics that they go home on, but we can certainly utilize some of these strategies and try and decrease the amount of narcotics that these patients need postoperatively, and ultimately try and decrease the amount that goes out into the world.